And thank you. I graduated in 1983, and we were on Mifflin Place. Does anybody know where Mifflin Place is? Okay, wait. By the Harvest, right. All those years ago when Cambridge College was small, a small but a mighty presence. And you know, the transition from 1983, when I got my MED, until I accepted this position with the Shattuck Hospital in 2007. Who's good in math? How many years is that? Really? Many, many, many years. I remember how proud I was. I actually spoke. Diane, I don't know if you know this. I actually spoke at the graduation in 1983 as well. Yeah, we graduated at Pine Manor College out in Chestnut Hill, out in the woods and out in the green. And I wasn't the valedictorian, but I was the MC. So I was preparing for my weekly television show in those years. And I'll tell you, I've always worked in nonprofit. I've worked in the public sector. I've worked in academia. I have served on many community boards. I still serve on 2 boards, one in Jamaica Plain and one at the Shattuck Hospital, the Shattuck Partners. And the confidence that I have to present to you, to talk to you, to be a creative person in staff development and training at the Shattuck Hospital is because I have that degree from Cambridge College. You know, I considered myself legitimate when I got that degree from Cambridge College. And I don't know I think probably more of you will have a more direct trajectory, a direct track into a position than I had. But, you know, life can throw you lots of curveballs. I don't know, has anyone been out of school for a long time here and gone back to Cambridge College? Go ahead, don't be afraid to raise your hands. Yeah. So you never know what environment you'll end up in. You never know who you're going to work with. You never know when that skill set and that credibility and that degree is going to come in and back you up and be handy. When I was walking in today, I saw a gentleman who's in one of your programs who I know from the Department of Mental Health and the Solomon Carter Mental Health Center, Solomon Carter Fuller Mental Health Center, and the human service world. So it's a very, very small world. Patricio, you and I, welcome, Patricio. Nice to see you. We've had some conversations with Patricio. We're thinking of establishing a Spanish for healthcare course at the Shattuck Hospital for healthcare workers. A little later, I'm going to introduce a very, very special member of the Shattuck Hospital. He is the head of medical interpreting services at the Shattuck Hospital, and we are so happy to have him here and so happy to have him at the Shattuck Hospital. It's my pleasure to have him here tonight. Okay, Alberto, stand up and take a bow now. And I just want to make my final remarks very brief. In the public sector where we are now, the challenges, as you know, working in the public sector are always there. They're particularly challenging right now. But I'll tell you something that the more you think about what you've done at Cambridge College, the more you think about the preparation that they've given you. It's kind of like you're riding on a surfboard. You know, you're able to, get on and off that board, get in that water, get back on that board, and make it in management, because Cambridge College prepares you for practical things in your life. You know, it's a wonderful, wonderful school, and it's grown so much since I've been in the school, so much. So it's my delight to be here, and thank you again. I'd like to say a few words about Alberto, if I may. And thank you so much for inviting me to your special ceremony. I am very honored to be included in the graduation, and I'm especially pleased to be here as you honor one of my colleagues from the Shattuck Hospital. Congratulations to Alberto Santaflorentina, our one-man, and he is, interpreting department. He deserves recognition for the excellent and sensitive services he provides, for his ability to manage the interpretation needs of a 250-bed public health hospital, and especially his wisdom and tutelage of his Cambridge College interns. As you honor Alberto, I would like you to think about what a vitally important role the medical interpreter plays in our hospital. We're not like the Giants. We're not like Mass General. We're not like Brigham and Women's. We're not like Beth Israel. We're small in numbers compared to the Giants, those Giants that I mentioned, but our inpatient and outpatient populations are those who present with multiple diagnoses, including infectious diseases, HIV, AIDS, TB, hepatitis. It's the safety net population, those with a history of trauma, addictions disorders, mental illness, and homelessness. That is our specialty. The difficult to treat, the difficult to manage. We are there for those people. Our patients are long-term, those most in need of reliable and appropriate language services. With Alberto's help, these patients connect with the multidisciplinary treatment teams and benefit from better patient care and better treatment planning from admission to discharge. Our interpreter services also help those patients continue relationships with family, friends, and treaters. It's the continuation. We are in the process of expanding these very important services, and Alberto's guidance of students, interns, and volunteers, and we have a volunteer in the house too. We have a couple of volunteers in the house. Okay, stand up and take a bow. I think you're a very powerful person. Alberto's guidance of students, interns, and volunteers has helped to identify these important needs in the hospital. I think actually at the moment we're actually building a bigger space. Is that correct, Alberto? You're going to have your own dedicated space and space to move in and space to meet with people. It's a good thing. It's a great thing. And finally, I'd like to give you a little breakdown of the languages of the patients who are there now. And Alberto, chime in if I've missed anybody. Arabic, Cape Verdean, Cantonese, Chinese, Creole, French, Haitian, Portuguese, Russian, Spanish, and Vietnamese. So we have a pretty wide array of folks. And again, congratulations to you. It's a wonderful thing that you've done for yourselves. You've all put yourselves through school, haven't you? Yeah? Okay. Give yourselves a round of applause. Thank you so much, and congratulations.